just continue to join us as we go, but let's get started. Welcome to Bladder Talks. My name is Shirley Weir. I'm the founder of Menopause Chicks. I'm so pleased that you have put your own name at the top of the to-do list today. We have a very important topic, and we're going to dive right in to talking with my own pelvic floor physiotherapist, Lacey Forsyth. She owns two clinics here in British Columbia, one in Port Moody and one in Langley. And I'm also joined by Derek O from UTIVA, and UTIVA has generously sponsored this event. So this is a free member event, and I can't do it without all the amazing partners and organizations who share the mission of Menopause Chicks and share our passion for women's health. So thank you, Derek. Thank you, Lacey, for doing this. Really appreciate your time and your expertise today.
Thanks for having us.
Yes, thanks so much for having us.
Okay, so this is how it's going to go. Lacey and I are going to chat about all things bladder health. And then I'm going to quiz Derek a little bit on some of the supports that are available at UTIVA. And then we're going to allot some time at the end for your questions. So do find the chat, pop them in there. If we don't get to all the questions, know that I am saving the chat and recording this event today because everyone who registered will be getting a copy in their inbox tomorrow. I woke up this morning and I was thinking about how to introduce you, Lacey, and I think a lot of my members already know that you work in my community and that you are my pelvic floor physiotherapist, and many have already watched our video from a few years ago. It's on my YouTube channel, youtube.com/menopausechicks, where Lacey let me record my first pelvic floor physio appointment. And I did that because I really wanted to inspire everyone to make an appointment with a pelvic floor physio. But I want to quickly tell another story, because when I started the marketing for this event, I encouraged you to bring your daughters and your mothers and your grandmothers to this learning opportunity as well. And it's going on a couple of years ago. I needed to find a gynecologist for my daughter. She needed to have a procedure done, and she had never had a pelvic experience, if you will. She doesn't have a family doctor. She had only seen physicians via telehealth, and she was 18 years old. And being a little bit of the control freak that I am, I couldn't imagine her having a poor experience. Maybe that if I had to take her to a walk-in clinic, I just didn't know how that was going to unfold. And then I remembered that we have these amazing professionals in our community called pelvic floor physiotherapists. And I really wanted to get not only an expert opinion for my daughter, but also to make sure that her first experience in pelvic health education and exam happened with a pelvic floor physiotherapist. So on behalf of me and my daughter, Lacey, I just want to thank you for being a part of our health team.
Thanks so much for trusting us. It's an honor.
So we promised everybody to talk about bladder health. Let's do it. What is the bladder and why is this so important for us to learn about?
It's a great question. A bladder looks a little bit like this. It's called the detrusor muscle. So it's a muscle like any other muscle in your body, and it can contract and relax. And it holds all of your urine. So it's like a little container in behind your pubic bone that stretches to accommodate as it fills, and then contracts to empty.
And so how often should we be thinking about our bladder?
Typical voiding times or bladder health, we should be checking in with it every 2 to 4 hours. If you are having a tendency to pee more frequently than that, then we might consider your bladder to be a little bit more overactive. If you are what we like to call a proverbial camel and you are voiding, every 6 to 8 hours, then, we might be wanting to check in to see kind of what your hydration levels are, as well as what's going on in your guts and pelvic floor muscles in particular.
So you and I work with a lot of people with pelvic floors, which is everyone. This is what I hear from a lot of members in the Menopause Chicks community. I wake up to pee.
Mm-hmm.
I have chronic UTIs. And then I even hear some extreme sad stories, which is, you know, I used to do blank. I used to enjoy whatever the activity or the hobby was, but I don't do it anymore because I'm always worried that I won't be able to find a bathroom in time. It's taken over my thoughts and my life.
Yeah. And that's something that we commonly hear in clinic as well. So that's kind of combining your comment there. It's three kind of separate topics. So if I could kind of
let's unpack them.
Let's unpack them just a little bit. So the first thing that you touched on was waking up at night to pee. Very, very, very common experience, I think, for a lot of individuals. And again, even though it's common, it's definitely not normal. So anyone under the age of 55 should be able to sleep like a full 7 to 8 hours without having to wake up to go to the bathroom at night. Over the age of 55, it is more common and considered normal to wake up once a night to pee, but nothing more than that. So individuals who are waking up frequently 2 to 5, 6 times even, I've treated, we consider that, or we would call that nocturia. So voiding in the evening at night. So there's definitely some causes and contributions for that. And that's something that working with a pelvic floor physio can help identify what might be a trigger for you, why you're doing it, and provide some strategies and solutions on how to get you sleeping, because our body needs that time to rest and recover. And if we're not sleeping properly, all of our systems aren't going to be working as effectively as they should be.
Right on. Okay, so let's go to the why. Why is it happening? Why are we waking to pee?
One, habitual. So that's often the big one. I find clients, especially in the younger populations, they've gotten into this habit of waking up with their kids when babies need to wake up, nurse, and feed. So they would just go to the bathroom just because, and that behavior is actually just kind of continued on 20 years later. It just becomes something that they've trained their body to do. You can train your bladder to trigger to void basically at any volume if you consistently and reinforce those cues and those behaviors. So we can learn to override those triggers at night and go back to sleep. And then over time, our bladder gets it. It's like that. I like to say it's like that toddler, like they push their boundaries and push their boundaries and push their boundaries until you give in. Well, if you keep giving in, they'll just continue to push those boundaries because they know it works. So learning to take charge and take control of your bladder is one of the ways that we can work with that. Another way that we can work with treating nocturia or avoiding at night is learning what our fluid consumption levels are like. How much fluid are we drinking 2 hours before bed? What are we drinking 2 hours before bed? Making sure that we are having clear fluids. We're not drinking anything irritating like tea or a glass of wine or anything like that. Those sorts of things can cause inflammation of the bladder lining and make it a little bit more irritable. So if your bladder is irritated, it's not going to settle into a nice quiet sleep.
Okay, I'm going to keep unpacking. So one of the things that I heard you say is that often, is it that we're not sleeping because we have to pee, or are we peeing because we're so habitual that as soon as we wake up, that's what we do? And I think that's a really important question to ask ourselves. Like, yes, there are definitely experts like Lacey that we can seek out and invite to our team, but we really have to check in with ourselves and figure out, what is this happening? What are the habits that have contributed to this?
Yeah, and that's a question that I ask my clients all the time, like, what's waking you? Oh, a noise woke me up, but then I was awake, so I just went pee.
Right.
Or, I couldn't sleep, I had a bad dream, or like my brain wouldn't stop like spinning. And those are the things that are keeping people up at night. But if you do that 2, 3, 4 days in a row, that's enough to create a habit for your bladder, to learn that, I'm allowed to void at this time of day. Okay. So over time, that will be the thing that'll start waking you up because you've created this pattern.
So important to the sleep conversation as well. Everything is linked, right? You mentioned liquids and what we're drinking. So can you give us some insight in what you want us to drink and what we maybe should think about avoiding?
So for anyone who has a tendency to wake up in the middle of the night to pee, we often recommend cutting your fluids off about 2 hours before bed to make sure that before you go to sleep, you have a full void. So you're sitting on the toilet, you're relaxing your pelvic floor, just to make sure that you're fully emptying your bladder. We could even try incorporating a double void strategy, that last pee before bed. So going to the washroom, standing up, doing some few hip circles, side to side movement to see if there's anything else, sitting back down. Again, try to relax and let that pelvic floor open up to see if there's anything else remaining in the bladder. That should give you the confidence to make sure that your bladder is in fact empty before you go to bed, so that you can go to sleep very calmly and confidently, that there shouldn't be anything waking you up at night. So those are a couple strategies that we often teach our clients. We should be avoiding bladder irritants before bed. And honestly, regulating and moderating those throughout the day in general. But if you do have a tendency to have more of a overactive, irritable bladder or waking up at night, irritants are going to be something that we'll definitely look at. So common things that would irritate a bladder lining or cause you to have some more inflammation in your urinary system, things like tea, coffee, decaf, yes, still an irritant, carbonated beverages, so bubbly water, any sort of pop, wine, any alcoholic beverages or irritants, chocolate. Most people don't know about, and a lot of people like to have a piece of dark chocolate before bed. So for some, if you're having 2 to 3, it can trigger some irritation and inflammation. Any sort of spicy foods. So if you had like a really spicy dinner, like a Mexican dinner or curry, it can trigger bladder inflammation. Tomatoes, any sort of citrus fruits. Those are sort of the big ones.
Heard that. Yes.
So depending on what you eat too, can cause some nocturia at night as well. Sorry to burst the bubble. But.
It's okay. For me, it's the soda stream. I mean, I like my carbonated water, but I'll listen to you on everything else.
Yeah, that's okay. And hydration is important. So sometimes we really have to like find that balance for our clients. Like if they don't drink soda water, they're not going to drink water. Well, there's more benefits to having some fluid consumption than to cutting it out completely. But it's just at what point is that threshold for you? How much can you have without triggering your symptoms? So that's kind of what we look for. I'm not in the business of like making your life no fun. I want to make sure that we are working within your parameters so that you're still able to enjoy the life that you want, but making sure that your symptoms are under control.
Yeah. And let me guess, it's not ever one thing. It's not like you're waking up because you had a cup of tea. It's always more complex than that, right?
Absolutely. Yep.
Yeah. Okay. So in the interest of time, let's jump to UTIs, because I mentioned that reoccurring UTIs, particularly in women over 55, which I know you use that age distinction, is really a common occurrence in the menopause chicks community. We had an event, by the way, in 2022 called Say Goodbye to UTIs, and it was our largest registered event in 2022.
Amazing.
I mean, yes, amazing that we're able to get that education out, but a little overwhelming for me to think that there are that many women who experience the chronic UTI. And so I'd love to hear from, from a pelvic floor physiotherapist, what your expert knowledge is around that.
Sure. That's a really great question. So understanding the mechanics or the mechanisms of why we get a UTI in the first place, I think is a good place to start. So a UTI will often develop when there's buildup of bacteria in the urethra, and then it can kind of travel backwards up into the bladder and into the kidneys to create a more systemic or more severe infection. So understanding how to keep that urethra clean is a good place to start.
Right.
So understanding basics of vulvar health and vulvar care, making sure that you're cleaning your vulva with just water. No feminine washes, no soap, nothing. Water, 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 water. And I find that depending on the age group, there are certain demographics that companies are marketing towards.
Sure.
So that is one of the causes of recurring or frequent UTIs is just general vulvar health and vulvar care. Some clients don't even know that they should be wiping from front to back. So again, like another really simple thing that we can do to make sure that we are taking care of our vulvar health and keeping that urethra clean. Another big contributing factor to UTIs is if somebody is wearing a pad or a liner daily.
Right on. Yeah.
Because they're experiencing some leakage and some incontinence. So having that moisture up against that urethral opening, any sort of chemicals or bacteria that are accumulating in those pads can contribute to persistent and recurrent UTIs. So from a pelvic health perspective, we recommend one, treating the source of the incontinence in the first place,
Yes.
to make sure that you don't need all of these over-the-counter products that add up to thousands and thousands of dollars a year, where oftentimes we can fix it in like 4 to 8 sessions. So, and then it's done. And then you're not spending all of this money year after year after year on these products. And if you do feel more comfortable with a product due to something else, like excessive discharge or something like that, using more like organic based products, like organic pads, liners, leak-proof underwear. There's some great companies on the market. So that's another contributing factor to recurrent UTIs. And hypertonic pelvic floor muscles is another one. So oftentimes, pardon?
What is that?
It's when your pelvic floor muscles are like this all day and they're just clenched and gripping and you're not able to fully empty and void through the urethra. So if you're constantly clenching, oftentimes you'll find yourself straining to go pee or have a bowel movement, and you're forcing fluid and stool through your sphincter. So that can cause persistent UTIs as well, because things are just in essence getting trapped. Hydration is another one too. If you're not drinking enough water or fluids, you're not flushing your system. And so again, bacteria can build up within the urethra and contribute to persistent UTIs.
Yeah. And then there's the subset of women who might not yet be using vaginal estrogen or systemic hormone therapy, and our pelvic floors are affected by that lack of estrogen. Do you want to speak to that as well?
Sure. So over the age of 55, like once we've reached menopause and we're considered postmenopausal, a lot of our collagen levels in our bodies like start to decrease, and we get vulvar and vaginal atrophy as a result. So things start to drop a little bit, start to sag. The urethra loses some of its bulk and elasticity and becomes a little bit more open. So it can kind of contribute to allowing more bacteria into the area. So yeah, vaginal estrogen is really important. And I know that there's some myths and some fears out in the world around that, based on some studies that were done a really long time ago, because everyone's worried that it's going to increase their risk of potential like gynecological or breast cancers, but it's not. It's only absorbed locally and it's totally safe to use, as well as any sort of vaginal moisturizer. So we need to look at protecting tissue integrity and tissue health once our natural resources for those items are depleting.
Amazing. Yeah. So what I take away from that, those are really great, succinct explanations, Lacey, is that you're not meant to suffer. There are easy, viable solutions. This might be step one, joining this call today and listening in. And then, there are lots of options and opportunities, and suffering is not at all on the menu.
No.
I want you to speak about the work that you do, but I first of all want to go to that number 3 concern that I hear the most. And that is from women who may be, in an extreme situation where an overactive bladder, incontinence, it's taken over their life. And it's not just the bladder health column. It's impacting relationships. Maybe it's impacting their lifestyle. They're no longer engaging in the activities that they used to love to do. And I would like to shed some light on that and shed some hope as well.
Okay, that's a great question. Overactive bladder is something that can actually be quite debilitating for people. Constantly wondering where the next washroom is, worried about when to go out of the house, peeing before they leave, making sure they have access where they're going. I've had some clients become housebound because prior to seeing pelvic floor physio, because they were so worried about finding a washroom that they started to get their groceries delivered and all of these things. They just wouldn't even go to the grocery store. So there's definitely hope. It requires a lot of mind over matter. In this case, we use a lot of cognitive behavioral strategies to treat overactive bladder from a physio perspective. So we'll often get clients to drink a bunch of fluid at home and learn to control their urges with a full bladder, with distraction techniques is one way that we teach clients how to do that. And then using some just calming strategies to calm the nervous system. Oftentimes with an overactive bladder, our nervous system is very upregulated, and we can often be very anxious. So using some calming strategies like mindfulness, meditation, yoga, things like that can be really helpful for managing overactive bladder. And I find too, just giving clients the knowledge that if they're using, like they have a organic liner or pad, or they're wearing leak-proof underwear, I say to them honestly, like at the end of the day, what's the worst that's going to happen? You might leak a little bit. Okay. But if you're wearing like a leak-proof underwear or something like that, you at least have a backup. Mm-hmm. Compared to what's the worst that's going to happen to your quality of life if you don't do X, Y, and Z.
Right.
So other things that work for overactive bladder are acupuncture. So acupuncturists can treat it. You can use like tibial nerve stimulation to treat overactive bladder. There is some medications on the market that can be helpful as well. But honestly, understanding your anatomy and changing your perception of your own control over your bladder. Like most people actually think this is passive structure that just exists in your pelvis and has a mind of its own, but it's not. It's a muscle under voluntary control. You can make it do what you want. So just even that basic education, general hydration, oftentimes dehydration is leading to overactive bladder too. So I find just, little simple changes over time add up to this like amazing overall end game for people. And it makes a huge change in their quality of life. Yeah.
I think that mindset piece that you've just explained brings such light to this conversation, because we probably regarded our bladder as a passive body part for 40, 50 years. I mean, I bet you everyone on this call, if we were to poll them, they'd be like, yeah, I really didn't think about it that much until there was an issue. And so mindset is part of all of the health information. This is work for many of us. This is like, oh, I've never, I have to focus and I have to do some work, but it's so worth it, as you said, because quality of life is essential. I would love to hear you explain, well, first of all, when we talk about bladder health, I think the first thing that comes to mind is often incontinence. And that is maybe in part by the TV commercials and the advertising that women in our demographic are often fed. It's just part of being a woman. And here's all of your options for incontinence pads. I want you to explain incontinence and explain prolapse so that we understand the difference.
Sure. So incontinence falls into 3 categories. So the basic definition is leakage of urine. And this isn't like a lot, it's considered 1 drop. 1 drop of urine is considered being incontinent. So there's a couple different mechanisms of incontinence. One is stress incontinence. So this is the one that most of the jokes are made about. Oh, I just leaked a little when I laughed, or I leaked a little when I coughed and sneezed. So in this situation, when we're exerting stress or pressure on the pelvic floor, we're not able to counteract that pressure to hold the urine in for some reason. So that's stress incontinence. Urge incontinence is when we get a really, really, really strong urge to go pee, and that urge becomes so overwhelming. Again, the pelvic floor muscles are not able to control it, and we leak. And then the third category is mixed incontinence, and it's usually a combination of both. So when clients are presenting with like a mix of stress and a mix of urge, we have to kind of tease them out and look at different strategies to kind of address it as a whole. The other major bladder condition that people always have questions about is prolapse. Now, bladder prolapse is just one type of prolapse. There's actually 6 different types of prolapse when somebody says pelvic organ prolapse. So a bladder prolapse specifically is what we in the medical world call a cystocele. And it's when the bladder moves down from behind the pubic bone into the vaginal canal. Now, a bladder prolapse has 4 stages, so 4 different stages of descent. And most of us, regardless of our age, regardless of whether or not we've had children, have some descent of our bladder. The research actually suggests between 85 and 90% of people have some degree of prolapse and have no clue.
And no symptoms.
Completely symptom-free. Yeah. Basically what happens is it's a pressure management problem. If we are not managing our intra-abdominal pressure in our core effectively or well, over time, that pressure is going to take your bladder and it's going to push it down and down and down. Now, frequent bouts of added pressure can cause stretching of the tissues, laxity of the ligaments holding your pelvic organs in place, and over time, your structures just kind of sit lower within the vagina, specifically for a bladder prolapse.
Okay.
Mm-hmm.
And can you quickly run through the other types of prolapse?
Sure. There's a rectal prolapse. So there's a rectal prolapse and a rectocele. So those are 2 different ones. Okay. The rectocele is an in-pouching of the posterior vaginal wall. So just a laxity on that end. A rectal prolapse is when your rectum actually prolapses outside of the external anal sphincter. Okay. We have a uterine prolapse. So that's when your cervix and your uterus sits lower down into the vagina itself as well. We have an enterocele, which is a prolapse of the small bladder. And then post-hysterectomy clients are actually susceptible to a vaginal vault prolapse. So that's when the top, where they remove the cervix and remove the uterus or the organ above, if your vaginal walls don't have strength and tone and structure, they can actually kind of cave down. And then the last one is a urethral seal. So you can actually get a urethral prolapse as well.
I've been speaking with many hysterectomy patients, members this week. So expect them to one of them is going to knock on your door. I would like to invite you now to explain what it is like to work with a pelvic floor physiotherapist. I know that many of us are curious about what that appointment looks like if you haven't watched my YouTube video, and as well as if you want to speak to, a couple of results or case studies, I'd love to hear those as well.
I wish you let me know that question in advance. I would have come up with some good ones. What it's like to work with a pelvic PT. I think it's the best thing in the world, but I'm definitely biased. I was very fearful of this area of practice for a really long time. I was very uncomfortable. I grew up in a world where Nobody talked about this kind of stuff. Your private parts were private, and they were nobody's business but your own. So I wasn't very comfortable when the topic came up in school. A little bit of a prude, you could definitely say. And there was just something within me that just made me put up walls and barriers. So from a pelvic floor physio perspective, I get it. And anybody who's a pelvic PT gets it. We need to understand and we need to recognize that this is a very vulnerable topic and a very vulnerable area for anyone to just have that open expectation to go into a clinic or an office and just be expected to like share their deepest, darkest secrets and information that we've never told anybody, like maybe not even their partner.
Yeah.
So working with a pelvic health physio, you need to feel first and foremost safe and secure in having that conversation. And you need to be able to open up and share your stories and be vulnerable with them. Because if you've seen any of our intake forums, they're very long and very lengthy. And we ask questions about bladder health, bowel health, sexual activities, birth history, traumas, like physical and emotional traumas, psychological traumas, because we need to understand you as an individual. So when you come into a pelvic floor physio's office, there is going to be a lot of paperwork. It's going to be very in-depth, and oftentimes our clients say it takes about an hour to fill out our forms. We sincerely apologize, but it's absolutely necessary. And you have the capacity to not answer any questions that make you do feel really uncomfortable, and we will avoid it. In our office in particular, we've designed it with very like warm colors, very homey touches. We've got a lot of plants and soft textures because we want to make sure that we are inviting you into our home so that you feel safe and that you feel comfortable enough to be able to like open up and tell us what's going on. During the appointment itself, we will ask you more questions. We'll ask more in-depth questions of things that you've listed on your questionnaire. We'll get to know you. And then if you're okay with it, we'll often either perform an internal or external assessment, whatever you're comfortable with. So going to see a pelvic floor physio, you can expect to be asked questions around your comfort level around having an internal vaginal assessment or an internal rectal assessment. So those are the sorts of things that you would expect. We do an external exam of the pelvic floor musculature, things like your posture, your feet even, depending on what's going on with your problem. So we look at everyone as a holistic individual from head to toe. And then we talk to you every step of the way. So we want to make sure that you're okay with how we are placing our hands on your body externally before we even proceed to an internal exam. We don't use any speculums. There's no stirrups on our tables. So it's very, hopefully a little bit more comfortable for people and less intimidating. And our clients have full consent of what happens. So if I always say to my clients, if you become emotional, overwhelmed, or uncomfortable with any point of the assessment, you have the capacity to revoke your consent at any time. Because like you said, like you want that first experience to be positive. And I think that learning to trust a healthcare provider with that area is key, because I know many of us have had not the best experiences where speculums have been forced open, or you've been uncomfortable from a cervical check or something like that. So
physical discomfort, and I think almost all of us have experienced poor bedside manner. We don't feel like we necessarily matter in all of our engagements. And I think that's why I love pelvic floor physiotherapy so much, is you truly feel seen and validated.
Yeah. And that's what I think is so gratifying as a clinician too. Being able to change somebody's mindset and educate them, and teaching someone. I'm trying to think of like appropriate stories for this community. I once had a client coming into me, and I know you wanted a clinical outcome. So I once had a client come into me, and she came to me for hip pain. And so we were kind of treating and getting at the source of her hip pain, and it was a pelvic floor contributor and a pelvic floor driver. And then finally, like one day I was asking her to do this cue, this pelvic floor contraction cue. And I said, can you nod your clitoris and think about arching it and putting it into your belly button? And she was 62 and she goes, what's your clitoris? I was like, oh, my friend, I am so sorry. She's like, yeah, like I've heard about this thing. And I was like, okay, like let's back the truck up here. Like she wasn't even aware of like what her anatomy was, nor had she ever had an orgasm. And I was like, okay, forget your hip pain. We're going to circle back to this clitoris conversation and we're going to learn about your vulvar anatomy, your like just sexual center. And she'd been with her partner like 35 years.
Yeah.
And it never
it's never too early and it's never too late.
Too late.
Yeah.
Yes.
Never.
And so I was like, I'm hijacking this appointment. This is what we're focusing on today. And she was totally okay with it. So it was so gratifying because she came back to her next appointment. She's like, you've literally changed my life.
Oh, wow.
And for me, that was so heartwarming to know that, like, you know, her years of like sexual activity had been drastically changed in a 45-minute conversation with me.
Right.
You know, she became more connected with her body, more connected with her partner, more connected with her mindset and her pleasure. So that is pretty cool.
That is very cool.
Yeah.
That's very cool. Thank you.
No
Thanks for that
problem.
amazing explanation. I want to very, very quickly try to bust some myths. And this probably leans to some of my learning over the last few years. We might invest in learning about perimenopause, menopause, postmenopause, and then we might hear about incontinence and we might hear the word Kegels, and then we might learn about pelvic floor physiotherapy. But some of the learning that I had was, you know, if you're experiencing constipation, a pelvic floor physiotherapist can help you. If you're experiencing pain with penetration, a pelvic floor physiotherapist can help you. And you've mentioned if you're experiencing back pain or hip pain, go see a pelvic floor physiotherapist.
Yes.
If you're not experiencing any of those things and you want to work at preventing your risk for some of these topics that we've talked about, go see a pelvic floor physiotherapist. It is a game changer, in my opinion.
Absolutely.
We are going to shift gears. I know this hour is going very fast. I want to talk to Derek for a couple of minutes about some of the supports that UTIVA offers women, and then we're going to jump into the Q&A for the last 15 minutes. Does that sound okay?
Sounds great.
All right, Derek, can you unmute yourself? No. Okay, hang on a sec. Sorry. Where are you? Sorry, everybody. There you go.
Hey, thanks. My kids are being loud, so I muted myself and I couldn't take back control.
Thank you very much for joining us, Derek. It's great to see you again.
Yes, thanks again for having us. Do you mind if I say one thing quick about the pelvic floor physio? Please. You know, we work with a lot of physicians, and I must say that almost everybody we work with always recommends their patients to go see a pelvic floor physiotherapist, and that's coming from almost all the urogynecologists and the urologists that we work with in Canada and the US. It's just a huge benefit in lifestyle modification and just treatment that can alleviate a lot of problems. So it's I love being a part of this, and thank you so much as well.
That's amazing. So tell us about what you do, Derek.
So as Shirley knows, I have a business partner and myself. For us, we come from the healthcare industry, in the medical device and the pharmaceutical world. So we're very familiar with a lot of these procedures that Lacey was talking about as well. However, we had a passion in the natural health space. We wanted to look at ways of prevention as opposed to treatment, because everything in our world is pretty much treatment. And, it actually started like from a personal story. My wife had a UTI. She was given the wrong antibiotic before a trip, ended up in a hospital overseas. It was a bit of like a nightmarish situation. And it just made us realize that, how could this have been avoided in the first place? And why didn't she respond to that antibiotic? We knew a lot of urologists or professionals in this field. So that led us to having a lot of these discussions and identifying why are antibiotics the only thing ever recommended, like for prevention or for treatment. And it led us down the path to identify, it led us down a path to identify a particular product that we could bring to the Canadian market. And there were only a couple of them in the US, and it was a unique cranberry extract. Back to the cranberry again, but it was very different in terms of identifying the active molecule from the cranberry that actually helps stop bacteria from sticking. But in the end, it's all about balance, like Lacey was saying as well. It's you don't always need to depend on a product, and if you don't have to take one, hey, we're all for improving health. But if there's benefit and you're open to taking something that could help as well, that's where we like to provide some value.
Amazing. Yeah. So I alluded to an event that I did in May 2022 called Say Goodbye to UTIs, and with a urogynecologist, Dr. Colleen McDermott. And I can't even tell you how many members have come back after that event, taken her, Dr. Colleen's advice, use vaginal estrogen, take cranberry packs. I'll get you to explain what a pack is. And there haven't been back to their doctor for another UTI in the last 6 months. And it's been life-changing for some of our members. I think it was from you, Derek, that I learned that UTIs are responsible for something like 8 million doctor visits a year. And if, like you said, the only thing your doctor has in his or her toolkit is a prescription pad for antibiotics, wow, we can do something to turn down the dial on that.
Definitely. And that was one of the main reasons we chose to combat UTIs, is because they account for one of the top 3 reasons antibiotics are actually prescribed globally. Right. So, if we can have something natural that helps stop them, like you said, and, we're not killing a bacteria, in no way are we treating it, and we will never say it's a treatment, but it's an ongoing option that you can take that's healthy. Like it's high in antioxidants. To answer your question about the packs, they are the active molecule of the cranberry that's well studied to say this is what stops bacteria from sticking. It's recommended on urology guidelines as well. It's a shame that most products out there have very little to no packs. And that's when it comes to price, that's why there's a lot of cheap things out on the market as well.
Yeah. So read the label, make sure that you know what you're buying. And so you have a product for UTI prevention, overactive bladder. What else is in your portfolio?
Well, we have a probiotic as well, but I definitely say our 2 main products at the current time, there's more coming, but the 2 main products are for ongoing UTI prevention, and also our UTIVA bladder health product, which was actually clinically tried and published in the Journal of Urology to show significant reduction in urge and frequency to urinate. But the main thing was having no side effects. So it was looked at as a part of the lifestyle modification, as well as if pharmaceutical drugs, if you have OEB and you're taking different types of pharmaceutical products, if they're intolerable, this is another option you can consider with no side effects.
Amazing. Okay, so I could do an hour with each of you, but we're going to try to stick to the agenda. Thanks to you and your team at UTIVA for helping us bring this informative event to the Menopause Chicks community. I hope you'll stay on, Derek, because we might have some questions for you.
Of course.
So Lacey, does wearing a certain material of underwear make any difference in getting UTIs?
Yes. Cotton only. No synthetic brands of underwear, please.
Got it. This is a bit of a long one. I have to avoid almost every hour during the day, though I'm on a blood pressure water pill, which makes it worse. I also drink a lot of water during the day and wake up at night to drink or pee. Constant dry mouth. I can't imagine drinking less because my mouth is so dry and I'm just thirsty. Sometimes I'll suck on a Ricola at night because water only doesn't always rehydrate my mouth enough. I don't know what to do anymore. I also have bladder leaks, so I tend to wear a panty liner. However, I'm now concerned that would lead to UTIs. I don't think there's a question there, but that's a lot.
It's a lot. I'd say see a pelvic floor physio and work with somebody to unpack what's going on there.
Yeah. And one of the best parts, everyone, about working with a pelvic floor physio is you're going to get a customized solution for you. And as we mentioned earlier, there's always this Rubik's Cube of events going on. So we host an event, the topic is bladder health, but we're speaking to a woman who takes a blood pressure pill. So that has to be layered on. And it's probably one of the reasons why your intake forms are so large, right, Lacey?
Yes. Yeah, we asked about general medical history, as well as like individual pelvic floor issues. Yeah.
Does having a prolapsed bladder affect all of this? I think they might have posted this when we were talking about UTIs. I'm not sure. Having a bladder prolapse does affect your bladder health. Go see a pelvic floor physiotherapist. Will pelvic floor physio appointments help with a stage 2 prolapsed bladder?
Yes, absolutely. Yeah, that would be Shirley.
Yes. Get your customized solution and then do the exercises.
Yeah.
I am a nurse, and I heard a urologist talk at a conference and said the first time you get the urge to void, ignore it. Helps with training the bladder. What are your comments?
Correct. I think that's great. So oftentimes that's a good way to like elongate the time between voiding. So we use distraction techniques in order to ignore that urge. I say to clients, if the urge comes back within 5 minutes, then calmly walk to the bathroom. You probably do really need to go. But just thinking like logically, did I go pee 30 minutes ago and then you get another urge? Like, really, does your bladder fill that quickly? No. If you've ever seen the rate of hydration of an IV bag,
oh yeah,
it's a really great visual. That is how our bladder should be filling. So it's like a drop, a drop, a drop. It's not this like massive flood, unless you haven't had anything to drink all day. You grab yourself a big glass of water and you slam it back. If anybody does that, just be prepared to be in the washroom a half an hour later, because you'll flood your bladder. It's not going to be able to absorb and process the liquids.
Got it.
So realistically, yeah, if you just went to the washroom in 30 minutes to even an hour and a half later, you get an urge to go, try and ignore or distract yourself from that first urge and see what happens.
And are there any exercises you can do at that time that would be helpful?
Yep. So you can just stop and take a couple deep breaths and do some gentle pelvic floor contractions. Our body's super cool, and our bladder and pelvic floor muscles work so well together. If the bladder is contracting, the pelvic floor muscles need to be able to relax in order to allow like fluid to exit the bladder. If you override it by contracting your pelvic floor muscles, the bladder relaxes. So they cannot both be contracted at the same time.
Amazing. Amazing. I'm not sure about this next comment. What about lateral spinal stenosis?
So stenosis is a really interesting topic. Depending on the nerve root level of the stenosis or the narrowing of the canal, the lumbar area wouldn't really affect your pelvic floor. But if you have stenosis in the sacral region, it can affect the nerve roots that supply some of the pelvic floor muscles. Yeah.
Okay. We have a comment here. I work with a pelvic floor physio, and it is very informative. Amazing. That story is so true. I think that comment came in when you were telling your success story about learning the anatomy. And I will say once again, it's never too early and it's never, ever too late. Circle back, woohoo, circle the clitoris, woohoo. Wow, that's amazing. Satisfying in all the ways. This is great. I know some of these people, so they're so amazing. Unfortunately, in Canada, prescriptions are paid for seniors, but UTIVA is expensive for us old folks. I completely understand that comment. I know that taking care of our health is expensive. And not taking care of our health is expensive too, right, Derek?
For sure. I mean, that is a common challenge that we have. Unfortunately, our products as natural, anybody who takes natural products knows there's little to no coverage at all for it. So what we try to do is, if there is a case where someone really needs something and we can provide that help, I would say don't hesitate to reach out, and maybe there's something we can do for you as well.
Yeah, reach out to me as well. You never know. And everyone's situation is different too. So there may, maybe your vaginal estrogen is covered, and you could start there, and then, you can kind of build a plan accordingly. Yeah. I feel for you. I took cranberry pills for years, certainly saved the day. That's a good experience. Make sure you tell everyone about packs, because they're like the most concentrated part and using the best part of the berry. My experience, the UTIVA D Manos 600 milligrams veggie caps with the packs for UTI treatment works best. Well, there's a testimonial for you.
Thanks. Yeah, nothing like a live one.
That's cool. Okay. And I love that this next question came in and I did not plant it. Why can't we just drink cranberry juice?
So great question. We talk about this quite a lot. In the end, like, we're looking for the packs, and cranberry juice, just like any other cranberry product, is very low in packs. Cranberries have about 1% packs. With our UTIVA capsules, we give about 15% concentration to get to the 36 milligrams. But actually, in 2019, the Canadian physician guidelines actually put out a statement that said, do not drink cranberry juice for UTI prevention, followed by, there's evidence for 36 milligrams of packs. So it was very timely that, the guidelines for the urologist came out around the same time that the Canadian physician guidelines said, stop recommending cranberry juice. So it's high in sugar as well, so we try to avoid the juice. I didn't know this until recently, but a glass of cranberry juice actually has more sugar than a glass of Coke.
Right. And even if you did rely on cranberry juice, I remember reading in one of your brochures, like, you'd have to drink like 16 glasses. Like, it's not one glass a day and that much sugar. None of it is going to do you any good.
Definitely. Yeah.
Are you able to recommend someone in the Vancouver area? I think this question is probably, this member is looking for a pelvic floor physiotherapist. You can go to Bump Physio in Port Moody or in Langley. And if you want someone in the Vancouver area, just message me and I'm happy to direct you to a pelvic floor physiotherapist. If you're watching from the United States, they're referred to as pelvic floor physical therapists. And you can ask at any physiotherapy or physical therapy office. If they don't have a pelvic floor physio on staff, I'm sure they know one in your neighborhood. You can do that as well.
There's also a couple of online search engines. So the BC Physio Association website has like find a physio function, so you can add it in there, as well as the APTA has their own directory in the States too.
Yeah, and I'll list them all in the community tomorrow or tonight. How much liquid is too much to drink at one time? Or rather, how should we be spreading out our fluid intake during the day to avoid the urge to urinate?
Great question. If you guys have been paying attention, I've been slowly sipping my tea throughout this presentation. Usually a sip or two every 10 minutes. That is how you should be consuming liquids throughout your day. So taking a water bottle, small sips, no big, huge glasses at a time.
Good tip to remember. And if you're already thirsty, it's like you're dehydrated, right?
Yep.
Does diabetes lead to overactive bladder?
That's more of a medical question outside of the scope of a physio's training.
Got it. How many Kegels is too much?
Well, it depends on what's going on with your pelvic floor. Sometimes I don't prescribe Kegels. They're not for everybody. So typically 30 Kegels a day is like the recommendation if you do have like a lower tone or a weaker pelvic floor. But if you're hypertonic, Kegels are going to be one thing that's not so good for you. So my recommendation is to get assessed to figure out what's going on with your body and go from there.
Shelley, this question about vaginal rejuvenation, I'll answer that in the community tomorrow, along with invite everyone to watch the Vagina Dialogues about all of your options that are on the menu. Bonnie asked what to do for a hypertonic pelvic floor.
Breathe.
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 Learn to breathe, maybe.
Learn to breathe, yep.
Yeah.
So diaphragmatic belly breathing, managing your pressures is something that's really important.
I have been going to physiotherapy for a few months for my plantar fasciitis, and I've just recently started Pilates at Bump. And the very first thing I had to do was to learn how to breathe again.
Yeah.
It's common. You're not alone.
Yeah.
Is UTIVA available in Australia, Derek?
We're not available in Australia yet. We are available in a few other countries, but we do ship direct from the US if interested.
Okay, amazing. Thank you. Can you recommend one exercise we should do in addition to Kegels or besides Kegels?
So again, Kegels, not always the best. I never prescribe Kegels unless I've assessed somebody's pelvic floor. Basic diaphragmatic breathing is your foundation for pelvic health. So learning how to breathe in different positions like lying, seated, standing is step number one. So that would be the one exercise I would recommend for everyone, because we will always start there.
Right on. Right on. Derek, you did mention this, but we'll say it one more time. Can you explain PACS?
Yep, no problem. So PACS is the short term we have for proanthocyanidins. Proanthocyanidins are the active molecule from the cranberry that actually stick to the bacteria to stop the bacteria from sticking to your urinary tract or your bladder wall. So when you pee, it naturally flushes out. And that's what the PACS do.
Love it. Love it. Love it. I had a great experience with a pelvic floor physio at Envision Physio in Vancouver, Falls Creek location. Amazing. Members helping members. Love to see that. You mentioned leakage and ignoring the urge to pee. What if you are unable to do that? I get the urge suddenly and then urine comes out and there's no holding it.
See a pelvic floor physio to find out why, because again, if your muscles are already clenched and hypertonic, there's going to be no additional muscle fibers left to be able to control it. So in those cases, sometimes I find if the urge comes on suddenly, quickly, and you can't control it, oftentimes your pelvic floor muscles are so tired and so clenched to start that learning how to relax the pelvic floor is the first place to go.
Thank you. Do you ever recommend PeriFit?
Depends on why you need pelvic floor muscle training. So I have recommended it to clients who've had difficulty connecting with that part of their body and who have barely a muscle twitch or a muscle flicker in their pelvic floor. Would I recommend it to everyone? Absolutely not.
Right. I think what we have to remember, everyone, is that, we're a profitable target market right now. And so there are a lot of messages that are probably landing in your inbox every day. And I don't know if it was you, Lacey, or not, but one of the lines I love is that you can't outsource your pelvic health exercise. Like, you have to do it yourself, but there are tools and tricks and everyone is different. And so when you work with a pelvic floor physiotherapist, you're going to get a customized solution for you. And it's probably not going to be something that you're going to see on Instagram and immediately have the solution. You need to probably talk, with a health professional and then build that custom solution for you. Derek, can we talk about Dean Manos? Sure. I think there's a comparative question here, but you could just speak to the Dean Manos.
Yeah. So the way D. Manos works is similar to that of PACS, but D. Manos is mainly studied against E. coli, which is a very common or the most common bacteria that causes a UTI. With the D. Manos, though, there's not enough studies. So it's not recommended on any guidelines right now, but we all know that it does have its place and its benefit. We still go back to cranberry PACS first because it's very simple. It's easy to take one little capsule a day, ongoing prevention. And if you need the D. Manos, you can add it in.
Awesome. And do you use UTIVA daily?
UTIVA cranberry PACS, we consider it a daily supplement. We see all kinds of benefits and great feedback. I welcome you to take a look at Shirley's website as well. That has information on there as well. You can see things on UTIVA's website, but it's an ongoing daily supplement.
Amazing. Thank you. And Vicky, for that last question, I would say the exact same answer that we had around the PeriFit. There's a lot of products out there. None of them are magic wands. Get a customized solution. Go see a pelvic floor physiotherapist. And we're at 5:02, guys. Pretty good. Pretty good. Thank you so much for taking time out of your day, evening, to share your expertise with us. I know that this was a really important educational event for our community at Menopause Chicks. If you're still on the call, know that I will be sending a recording of this session in your inbox tomorrow. Please share it with all those that you love, younger, older. There's probably someone who is experiencing challenges with their bladder health and really don't know where to turn. So you can be that person. And yes, I just want to say thanks again, and we'll see you soon.
Thank you so much for having me. It was nice to meet you, Derek.
You too, Lacey.
Thanks, Derek.
Nice meeting you. Thanks, Shirley.
Good night, everybody.